No, what we've done is we've listened to the public, and the public told us, focus on the things that matter to us. And that's what I've done. Since I've come into power, I have changed the entire system to make sure we're focused on the 4 priorities I've set out, that the public told us the things that matter to them. This budget is absolutely focused on the things that matter to the people of Wales, and I will be ruthlessly focused next year in delivering on those ambitions.
So you've had a few months in the job now. NHS waiting times is is the main priority, I'm right in saying, isn't it? Bringing down those longest waits. They've hit record levels though. They've been going up month after month, 7 months now. It's hit over, the longest waits over 800,000 for the first time, and the total number of patient pathways is rising as well. So it seems like demand is rising.
So demand is rising, but let's be clear, there's a difference between the numbers of people and the longest waiters. And there are lots of interventions that are not as urgent as others. So we prioritise urgent care, we prioritise cancer, and then we're prioritising also the longest waits. So rather than people picking off the easy things that get through the system quickest, we're saying actually there are some people who've been waiting for way too long, get those done, and obviously we carry on doing the simple things, but we can't forget the people who've been waiting, very often with complex cases. So you might need a hip replacement, but you've got a heart disease problem as well. It means it's more complicated. What we're saying is stop putting it off, get it into the system, make sure it gets done. All of that is in the system now, and the key thing is we now have a budget like we haven't had for years. The biggest uplift in terms of money coming to Wales since the beginning of devolution, and a lot of that money will be going to health.
So when will the people of Wales actually see those longest waits coming down? Because people are getting impatient, frankly, aren't they?
So the longest waits have been coming down, so there's been a real focus. If you look at places like Swansea Health Boards, they've now got a hub, an orthopaedic standalone hub, that has brought the numbers waiting in that part of the world tumbling down. So things are improving. When I first became health minister, there were people waiting for six, 7 years for treatment. We are nowhere near that situation today.
Can you put a date or a target when we will see those longest waits actually coming down or being eradicated, which was the original post-COVID target, wasn't it? It seems like that target is getting further and further away. Is it impossible?
So I'm hoping by April we'll be in a situation where we'll have perhaps no more than about 8,000 people waiting for 2 years. So that will be a huge improvement on where we were at the end of the pandemic. So that would be a significant change, and obviously that £50 million we put in this year, don't forget the budget we just had, we've just announced, is for post-April. This is money we're putting into the system, 50 million this financial year, to make sure that doctors and nurses are working weekends and overnight, that they're able to do that. We weren't able to do that for the past couple of years because the budgets were so tight. So this additional funding that is coming, because we've got a new UK Labour government, is going to be the difference.
So are you saying 8,000 by April, eradicated by when?
Well, look, let's make sure we hit that target first. Let's make sure we're getting those down. And obviously, it depends then on making sure that we've got enough capacity in the system, that people stick with it, that we're able to, if necessary, buy procure some from the private sector if we need to. But the key thing is that we've now got the additional money that we had to cut back on. We weren't able to ask people to do those overnight work and weekend work because we had to pull back because the money was so tight.
Okay, councils then, they say they needed a 7% boost in funding. They've been given 4.3%. One council, Flintshire, says it could go bust. Others are in the same position. You say you're confident that won't happen. It seems like a low bar though, doesn't it? Okay, they might not go bust, but are they delivering the public services that people expect of them, and especially social care, when they are key to resolving the other big issue of the NHS?
Well, I spoke to the leader of the Local Government Association yesterday, and he was saying that actually it's an absolute relief compared to where they've been in the past. So it's 4.3% uplift on top of the massive chunk of money we've given them this year. So that uplift has already happened. So over 2 years, it's significantly more than 4.3%. And they know that that is massively better than in the past. And some of that money will be going to address the issues of social care, but also a lot of it is going to help resolve problems in schools. You know, the number of children with ADHD and additional learning needs has massively increased, and obviously we need to put additional funding into that. This doesn't happen by magic. We've got to find the money for it. The money now is available thanks to the fact that we have a UK Labour government in Westminster. We are challenged. We've got to get this budget through, but people need to understand, if we can't get this budget through, then all those people waiting for an ADHD assessment, all those people who are waiting on those waiting lists, it's £1 billion extra that won't come unless we get this budget through.
It's been brought up a lot this week, but there is a kind of an absurdity to the fact, really, that, you know, much of that money will go straight back down to the coffers of the Treasury in national insurance contributions. Councils aren't going to know how much they have to pay until, you know, the summer, which, you know, seems, well, you said yourself, it was a ridiculous situation. And, you know, they are giving with one hand and taking away with the other. That must be very frustrating for you.
Well, I think if people are directly employed, then the UK government has said that they will cover that.
But there are so many people, particularly in social care, that won't apply to. That is a problem, is it not?
So that is where, you know, the fact that they've been given this additional uplift will help to cover some of that, and that is
all of it.
Well, there's enough there, 4.3% to cover the additional.
But if it goes there, then it's not there for public services, isn't it? Well, it is giving with one hand and taking
public
away
services,
with the other.
These are public services. These are public services. These are people who work in social services. People work in those sectors are the people who will benefit. So, and don't forget, there's also an uplift. There's the fact that there's going to be an increase in the living wage. That is also a help for our communities, and all of those things have to be taken in around.
What strikes me when kind of faced with this situation is that much is made of two Labour governments working together, but it doesn't actually seem that much better. You've got the issue with national insurance contributions. You still not. It will be barnetised, it might not cover, it might not meet the need. No, as you said, no money for the private and third sectors, nothing on HS2, nothing on the Crowd Estate, no fair funding. It seems like the only thing that's really changed since a UK Labour government has been elected is the Welsh government's rhetoric on it.
I can't believe people are laying that at our door. The fact is that people in Wales...
You're not calling out the unfairness of it.
Hang on, we've just had £1 billion extra for next year. This is an absolute, completely different world from where we've been for 14 years with austerity. I'm not taking that as an accusation. The fact that we've been able to give above inflation pay rises to people in the public sector, hundreds of thousands of people in Wales, is because we've had a new Labour government. That didn't happen before. So let's also, you're right, there are areas where we'll be asking for more. HS2, every time I see the poor Prime Minister, he's sick of me asking him for money for HS2.
But is he listening?
But they did give us an extra 25 million for coal tips. And
which won't touch the sides, will it?
Wait a minute, we've been asking for 4 years from the Tories.
So we should be grateful.
And they gave us nothing. They gave us nothing, and this is the beginning of what we're expecting. And those conversations and those discussions will continue. But let's not complain that we've just had an extra £1 billion after we've been waiting through years of austerity where we've had to face cuts after cuts after cuts. It's actually a time to celebrate, to look with hope to the future. That's what I'm looking for in the new year. I'm looking for a bit of hope. People are sick of the doom and gloom, the fact that what you've had is a cost of living crisis which is still really hurting people. They want a bit of hope, and this budget you've just seen is going to give them that hope.
I was looking at the polling over the last few days, and you know, you've tied yourself in with Keir Starmer, haven't you? You know, you're working together, you're best pals. Is he becoming a little bit of an electoral liability, though? And at what point, you say you're looking ahead to the Senedd elections, it's going to be extremely tough for you. When, is it time to cut him off a little bit, or to bring in that clear red water?
Well, look, first of all, I'm going to celebrate the fact that we've got an extra £1 billion, right? That's the first thing. And the fact we've just had a massive increase this financial year that has helped us to address things like, we've got new diagnostic kit in our hospitals that are going to speed things up. We haven't had a capital injection like this for years and years and years. This is going to be transformational. It will take a while to get through the system, but for the first time in years, we can breathe. And I think that is really important. It's a signal for the future. It's not going to happen overnight, but let me be clear, I'm going to celebrate with Keir Starmer when he gives us money. When he doesn't, and I think we deserve it and we need it, I will make sure that he knows that I'm not backing off. So, I will be clear that I will stand up for Wales first and foremost. Before I do anything else, I am putting the people of Wales first. And when I think there's unfairness, like in HS2, I will make damn sure that they hear that loud and clearly.
Eluned Morgan, as always, thank you very much.
Diolch yn fawr.